Hello, everyone. Rebecca Weber here with your AMAC podcast, Better for America. If you're not getting your political news from AMAC, then you won't be informed about American politics, so make sure that you go ahead and hit that subscribe button. And to all of our AMACers listening, thank you for tuning in. Now, joining us today is AMAC's very own Carl Hosfield, and Carl is a key part of our remarkable leadership team. He's a substantial contributor to our membership benefits programs, and he helps us deliver high-quality services to our membership. He's a Medicare expert, licensed in all 50 states, and Carl has assembled a team of professionals who take calls from AMAC members and help them navigate the complexities of Medicare. Carl, it's a pleasure to have you here with us. Thank you so much, and welcome back to the show.
Thank you for having me, Rebecca.
Carl, I want to talk a little bit about what season we're in right now. A lot of people are seeing commercials blasted all over their televisions, and that is the annual election period. And the reason why I want to talk about this annual election period is it's directly related to Medicare. And with your depth and breadth of experience in this field, in this industry, our AMAC members, I think, I'm going to ask you a number of frequently asked questions that our members have been writing in. They've been emailing us, they've been writing in. But before we get to that, I want to talk about the season that we're in, and that is AEP, the annual election period. This is our annual open enrollment period. It began on October 15th. It will end on December 7th. So if you could, Carl, explain to those listening, what is the annual election period? How does it really work? Why is it so important for those who have a Medicare plan to know about this period of time?
Right. So the annual election period basically gives everybody who's Medicare eligible or will be becoming Medicare eligible soon the ability to check their current Medicare Advantage plans and determine should they stay on that plan if it's still available in 2023, or should they change to a new plan that's more suitable for them. It also allows them to do that with their Part D plan or prescription drug plan. They want to check that every year between October 15th and December 7th. Now, the plans were released on October 1st, and enrollments can begin on October 15th. The deadline is December 7th, and that's very important because if you currently have a Medicare Advantage plan or a prescription drug plan, and you want to change to a more suitable plan or to a different plan because your plan is going away in 2023, the deadline for that is December 7th, and the beginning of that is October 15th. And the ability we offer is for individuals to call AMAC and speak to one of our licensed agents or licensed professional Medicare agents and look at options that might be available in your area. And our agents, completely unbiased, will help you as an AMAC member find the plan that's right for you.
Yeah, I really love what you've created, Carl, is this sort of one-to-one relationship where members engage with an agent and they always engage with the same agent. So you're really building rapport with somebody who is an expert in this area. Explain to our listeners why this period of time exists and how a Medicare Advantage plan is different from a Medicare supplement plan, because I'm picturing a lot of people out there have a Medicare supplement and they're saying, well, I haven't heard of a Medicare Advantage plan, or what is it? What should I know about it? Can you share a little bit more about what they are and how they work?
Sure. Great questions. So a Medicare Advantage plan is also referred to as Medicare Part C. Some of our folks might have heard of that before. A Medicare prescription drug plan is also known as Part D. Now, Medicare supplement, or Medigap is another word for it, is not a Medicare Advantage plan. It's not Part C or D. And that a Medicare supplement or Medigap plan doesn't necessarily relate to this annual election period. This annual election period is specifically for Part C and Part D plans. Now, one of the important factors to understand is that a Medicare Part C plan or Part D plan is only guaranteed for one calendar year, January 1st to December 31st. It's guaranteed so that every customer, every Medicare eligible individual understands this is my plan for any given calendar year. And what they do is at the end of the year, between October 15th and December 7th, they open it up. They redefine the plans for the following year, and they give you this 7.5-week period to identify what plans might be available the next year. And so sometimes it might mean staying on your current plan if that's still being offered by your private insurance company. Sometimes it might mean your plan's going away, but there are new plans to replace it that might be better for you. And that's why it's so important we ask our members to call AMAC and speak with your agent. It's free. It's no difference in cost whether you do all this research on your own, which could be a daunting task, or you use a licensed agent to do it for you.
Yeah, that's really fabulous. I love what our team does. They work here in New York, on Long Island. They're in Florida. They're in New Mexico. We've got folks in Arizona. And really in all parts of the country, we have independent agents. We have so many people available to speak with you. When you call us, we give you that really wonderful one-on-one type service. You're not bounced around talking to too many people. But I want to encourage people, the sooner you call, the better, because we can set up an early appointment to speak with you. And you can avoid those long hold times and those long wait times, which we know, we see them year over year. And we do the best we can to get to every single person. But before I get to my next question, Carl, I want to ask you, is this truly the only time when someone can switch their Medicare Advantage plan? Or are there certain exceptions whereby someone could change their Medicare Advantage plan at other times during the year?
Another great question. So the annual election period is for people typically that are already on a Medicare Advantage plan or a drug plan, right? And that allows them to just look at what plans are available again for the next year. But if you're new to Medicare, you have a 7-month window, basically the month before you turn 65, or the 3 months before you turn 65, the month of your 65th birthday, and the 3 months after. That's your initial election period, right? So you're not held accountable to the annual election period if you're new to Medicare anytime this year. You're what's called your IEP, or your initial election period. Also, there are things what are called special election periods, or SEPs. I know we have all these fun acronyms for everybody, so I'll try to not use the acronyms, AEP, SEP. Point is, special election periods are for people that, for example, move out of a planned service area. If you enroll into a 2023 plan and you live in Texas, for example, and in 2023, in the middle of the year, outside of the annual election period, you move to Florida, you will be required to change your Medicare Advantage plan or prescription drug plan, but you have a 2-month window to do so once you notify your insurance company. And that is what's called a special election period. So there's examples of situations outside of the annual election period that you are eligible to make a change. Now, there's also what's called the open enrollment period, and please don't get that confused with the annual election period. That runs from January 1st to March 31st. What that essentially does, it's a relatively new enrollment period, and that allows individuals who enroll into a plan this annual election period, begin using your plan in 2023 starting January 1st, but determine in that 3-month window, you know what, this plan isn't necessarily right for me. I've utilized it. I have a one-time chance to make a change. But all of this is an important reason to have an agent that you work with.
All of these dates that Carl is referencing, you can go to myamacmedicare.us. I'm sorry, myamacmedicare.us. We'll go ahead and put that here as well for you to go ahead and click that link, because there's a lot to know. And remember, Carl, you mentioned earlier when people call in that they speak with our licensed agent, and that agent reviews their choices. And I loved hearing that we offer choices. I mean, it's one of the reasons why we worked so hard to build this for AMAC members, is we did not think that a one-size-fits-all approach was the right way to go. We know that there are other 50-plus organizations that offer only one choice or one carrier choice.
First of all, AMAC works very, very diligently to only partner with trusted insurance companies. Okay, many insurance companies you've heard of, companies like Aetna, companies like Humana, companies like Blue Cross Blue Shield, right? Companies that have a reputation for being in the Medicare business for a very long time. Our Medicare Advantage plans are rated in a star rating format, and we only work with insurance companies that have high star ratings with Medicare. And on the Medicare supplement side, as you said already, Rebecca, we only work with A-rated, financially rated companies.
Some of these smaller companies that don't have the financial strength They haven't been around very long. They often will come and go very, very quickly, and you could be left with being put in a difficult situation. So I think it's critically important that you know from which carrier you are purchasing a plan, and also that you only need one plan. Someone might try to sell you a Medicare Advantage plan when you have a Medicare supplement plan. That will never happen here at AMAC. And Carl, I know that you're going to share some tips for folks to really watch out for,
Right.
As they probably begin to get approached both by direct mail, perhaps even via phone call, unsolicited, because those are important things to look out for. Before we go there, Carl, I want to talk a little bit about, I brought up the website, myamacmedicare.us. Share with our listeners this awesome self-enrollment tool that they'll find right there on the website.
Yes, yes.
Because while I think it's extremely important to converse, and we encourage that people do call us, we offer more options, some of them digital. Go ahead and share
right.
that.
No, thank you for bringing that up,
Yeah.
Rebecca. And look, we are fully aware that our membership base and our AMAC members and future members who are not members yet are very knowledgeable about this industry. And while we encourage you to work with an agent, or at least speak with an agent, have a conversation at any given point, we also are fully aware that we have many members that have gotten to the point that have been on Medicare for years, who are fully able and capable to enroll themselves. And we now have a wonderful tool on AMAC's website. And again, you'll see the link there on the screen. AMAC's website, where you can go and enroll yourself. And basically what you're doing there is you're looking up options for Medicare Advantage and prescription drug plans for yourself. You're able to enter your own prescription drugs. You're able to enter your own doctors to see if your doctor's in the network, and ultimately navigate your way in a handful of steps to the end and enroll yourself in the Medicare Advantage plan or the prescription drug plan that we offer of your choice. And along the way, you still have our agent team as support. If you hit any roadblocks, any obstacles, or if there's some confusion, you could still pick up the phone and call us, and we can navigate you there the rest of the way.
From one of our members, they called in and they said, can you explain to me the basic differences between a Medicare supplement and a Medicare Advantage plan? I will be soon turning 65, and I'm not sure which plan I should be looking at. And that was by John M., who wrote in for that question.
Yeah. Now, a couple important factors, right? When we talk about the difference between a Medicare Advantage plan and a Medicare supplement plan, first of all, Medicare Advantage plans have networks, meaning you must go to the doctor that's in that plan's network if it's an HMO. If you go out of network, except for emergency service coverages and urgent care services, you do not have insurance coverage. If you have a PPO, you typically have in-network coverage and out-of-network coverage. Out-of-network coverage is typically a higher cost sharing from the patient side. Medicare Advantage plans typically include drug coverage, as I've said before. And Medicare Advantage plans typically have little to no premiums. Okay, that's very, very important, because somebody that might say, I can't afford a Medicare supplement plan, I like the idea of little to no premium monthly, and I'm okay with certain cost sharing when I go to the doctor, when I go to the hospital, if I have to go to urgent care, then I know what I have to pay based on my summary of benefits. Now, a Medicare supplement plan works very, very differently. A Medicare supplement plan basically runs alongside your original Medicare Parts A and B. Medicare Parts A and B have certain coverages with no out-of-pocket maxes. So what a Medicare supplement does is it does exactly what it says. It supplements or fills in the gaps of what your original Medicare does not cover. Medicare supplement plans typically have a premium, a monthly premium, that could range in a variety of dollars depending on what plan you enroll into. But there's also no networks. So if you have a Medicare supplement plan, you could see any doctor who accepts Medicare coverage anywhere in the United States. So I mentioned before, if you move
Good for those travelers.
Good
for our members who are traveling.
Homes, for people that simply don't like being restricted by a network, right? They say, hey, I have the opportunity to see a specialist somewhere else in my town, somewhere else in my state, or in a different state entirely. If I have a Medicare supplement plan and that doctor accepts Medicare, I can see that doctor, and it's a seamless coverage, okay? You simply give them your insurance card, or they'll look up your insurance information, and you have your Medicare coverage that way. Now, Medicare supplement plans do not include drug coverage. So what it allows, the federal government allows an individual, if they're on a Medigap plan or Medicare supplement plan, to choose their own separate standalone prescription drug plan. And then in that case, they have the original Medicare, their supplement plan that supplements what original Medicare doesn't cover, and their prescription drug plan that covers the drug costs they need.
Excellent. Carl, what a great description. So really, for those listening, I mean, it's a Medicare Advantage plan has its perks. They may be much more affordable, sometimes coming with zero premium. The negatives are you have to work within a network. It may be a local network, maybe not very good if you're a traveler and you're going to be in Florida, in the summer and somewhere else in in the winter and somewhere else in the summer months. So these are all important considerations.
That's right.
Thank you so much. Before we let you go, Carl, we want our members to watch out because there are people out there that are up to no good. And unfortunately, seniors are really, people are going after seniors. We hear it all the time. We get phone calls from AMAC members saying, I received a call and this is what they said. What should I do? And so we just want to really make sure that whether it's you who are listening or if you have a family member, a friend, a neighbor, we want you to let them know that they should not be giving out personal information like their social security number and such unless they know exactly who it is that they're talking to. But some do's and don'ts, Carl, if you could.
Right. So we all know, we need to just say it how it is. Fraud is becoming a bigger issue, especially within the senior community.
Mm-hmm.
It's a highly preyed upon demographic in our country. And that's why the federal government, organizations like AMAC, work very hard to protect seniors and offer them proper advice and go through the proper channels to avoid fraud. Okay, so if you're getting phone calls from unrecognizable numbers from people that you did not agree to speak to previously, we highly suggest that you wait and you vet whoever's calling you first. And if you have questions or concerns, don't pick up the phone, or surely don't give out your personal information like protected health information, even your address, your date of birth, your social security number, your Medicare claim number. Okay, these are not things that you have to offer somebody unless you know you're working with a trusted agent. Now, I realize there are times when you're not sure. Well, if you're not sure, I can tell you one thing. You can call AMAC, and if you have questions about that, our agents will tell you everything you need to know about Medicare, what you need to offer, and what you don't. For example, when you're enrolling into a Medicare Advantage plan or a prescription drug plan, you do not give your checking account information. You pay two ways. Even if it's a zero premium, you're still required to either pay through Social Security deduction or through the Railroad Administration if you're eligible for that. But we, for example, for Medicare Advantage or prescription drug plans, will not be asking for your checking account information. We will on a Medicare supplement plan, but only after we go through a full needs analysis. And so these are little things to work out. Don't give your information out through texts. Don't give your information out through unverified emails. If you're unsolicited to, for example, Medicare has very strict marketing rules. If you're getting phone calls that you did not ask for, if you're getting phone calls or emails from organizations that you don't recognize, then we highly suggest you avoid communication with those type of organizations. And we hear it from our members all the time. They call us and they tell us what they're seeing and what they're looking at and what the information they're getting, and we say ignore that. Unless you trust and you know where it's coming from, we highly suggest you only work with organizations that you've agreed to speak to already.
That's right. Carl, this was really great. I really appreciate your time here because really your passion for ensuring that our members have the proper plan that best suits their needs, both financially and medically, that's so important. It's vital. And we're just thrilled to be able to offer this to over 2 million AMAC members. We're helping hundreds of thousands of people over the last 10 years. Just amazing what we're doing. So thank you so much for your leadership.
Thank you, Rebecca.
And for those of you who want to give us a call, that number is 1-800-334-9330. That's 800-334-9330. Or you can go ahead and visit myamacmedicare.us. Thank you so much for tuning in today. If you've enjoyed this episode, you can go ahead and listen to more just like this one by heading to our YouTube channel. Go ahead and search AMAC, that's AMAC, or you can visit us at bfapodcast.us. You can also listen to us on iTunes, Spotify, or by downloading our free AMAC News app. Until next time, I'm Rebecca Weber. This is your podcast, Better for America. Thank you for being here. God bless you. Have a great day, everyone.